so that we can start our question answer session. Otherwise, what happens that you join in late and then the questions are so much in a hurry that I can't answer. So going forward towards the question answer session, before that I'll just discuss a case of which I got relief. Just give me questions on the YouTube rather than on the WhatsApp, so that it becomes difficult for me to join answer them. There was a simple case of acne. Now, whenever the case of acne or eruptions on the face comes, sometimes it becomes difficult to treat because the symptoms are not so proper. It is either blackish in color or reddish in color or a greasy or oily face, and the patient wants it removed very fast because the patient says that I have to go to a party, I have my engagement, I have a marriage, do it fast. There was a case where there was a lot of acne simplex on the face, reddish, painful. Nothing was working in that case. Suddenly, what happened that patient came after 2 months and said, sir, there is no change as such. Whenever the acne starts coming, whenever the pimple starts coming, it first pains and the pimple starts, the acne starts, and they're very painful after that. And I had given her the few medicines which did not work, and then I prescribed the patient arnica in LM potency 0/3, which I had. She came after 15 days. She was 60 to 70% better. So it is important on which symptom you prescribe the medicine. We can prescribe on many of symptoms like oily face, greasy face, blackish eruptions before menses, after menses, acne rosacea, acne because of gastric problem, acne which are very indurated, acne because of sexual excess, acne because of using a lot of cosmetics. There are a lot of symptoms to prescribe for. But what symptom you take for prescription is very, very important, and that is the entry point of the case. I hope everybody is hearing. It's online because I have till now no questions. Otherwise, when I start the questions, I hope everybody is online. Hello, are you listening me, everyone? So these were the first symptoms that these were the symptoms which you have to take for prescription. In that case, I just only took one symptom, that is eruptions, acne, painful, arnica 0/3. That cured the case. In acne, there are a lot of other symptoms, other modalities also, which are very important, which I would like to discuss today. In practice, when you start your practice, there were a lot of questions. Maybe I think the juniors or the upcoming practitioner has asked me how to treat acne, because when you're new in the practice, these elements like acne, hair fall, itching and all, they come to you for treatment. As you gain confidence in your practice, automatically then other diseases would start coming. Now, one symptom is very, very common which has to be remembered, that is acne or eruptions because or with menstrual irregularities. Whenever there is a menses problem, the acne starts. Hello, Dr. Marble, Dr. Pandey, good afternoon. I was just discussing cases, my cured case, now acne because of menstrual irregularities. Berberis acufolium is a medicine which is used very frequently, sometimes misused or abused also, because we use that remedy very frequently. My observation of acne for berberis is, whenever there is acne because of menstrual irregularities, you must think about berberis acufolium. Of course, there are other medicines also. When the menses are irregular, you can think about berberis acufolium or graphitis, semesifuga, pulsatilla, and sanguinary also. Normally what happens, there are a lot of doctors, including me in my past practice, used to, whenever a case of pimples comes, we used to prescribe berberis acufolium because it was such a drug that everybody used to prescribe every time. But there are some symptoms of berberis acufolium that you should remember. Either I tell the symptoms of berberis acufolium, or we can go to some other modalities of acne. There were a lot of questions on acne on my WhatsApp chat also, but that's why I'm telling you something about acne. But in the meantime, I'll just take a question. Good afternoon, sir. Female age 45 suffering from right side sciatica, better by hot application and walking, moving worse by sitting and lying down, ascending and descending stairs, and stooping forward. I think sciatica I had done in my previous YouTube. You know, there were a lot of questions on sciatica. Of course, sciatica is a very very painful condition, and it's very important to understand how to treat sciatica. Now you have written that sciatica. I would be happy that if you write which side of sciatica, then that question becomes very very particular. You know, otherwise you can always say hot application, cold application, amelioration, and there are a lot of remedies for that. So first I'll just discuss your case, and then if you have some modality, we can move forward. Now, whenever there is sciatica, there are some remedies which are very very commonly prescribed, and you should also think about those remedies. Those you can write down. I had told before also in my YouTube. That is Rustox, Tellurium, Nux vomica, Hypericum, Bryonia, Colocin, Arsenic, lot of remedies. Phytolica, Phosphorus, these are the remedies. Now you have written that hot application ameliorates. You can think about remedies like arsenic album, Nux vomica, Iris Wurs, and Rustox. Because these remedies has hot application amelioration, formication, numbness also in walking. Depending on the side also, then you can differentiate and prescribe the remedy. Okay? Hello? Are you with me? Sir, tubercular lung empyema, homeopathy medicine. First of all, Dr. Sani, I always say, you have to be lucky to get these type of cases in your practice. Like for instance, I had cases of hydrocephalus, I had cases of renal failures, cases of chronic migraine, because this case basically gives you confidence also, and this case helps you to explore a lot of other remedies in your practice. Lung emphysema is a very very interesting case, and you have got it so very very nice. Tubercular lung empyema. Now for this I will require symptoms to prescribe. As such, tubercular empyema, if I want to tell you randomly, you can think of remedies like phosphorus, like kalicarb, like silicea, like kali iode, like tuberculum, like lot of remedies. There has to be some symptoms which will basically lead you to find the simillimum. Okay. Assalamu alaikum, sir. I am Raja Nafis from Islamabad, Pakistan. In sciatica, I find Medorinum the best. Okay. All remedies are good. Whatever has given you result is the best medicines. Okay, sir. Thank you so much. Yeah. So I was just talking about something about acne, and acne because of menstrual problem. I have given you some remedies. Now there are some, acne modalities. For example, acne during menses. Some patients would come to you and say, Doctor, whenever I get periods, menses is not a problem, but I start getting these pimples. So please treat these pimples. So acne during menses, this is a very very important symptom, and a very very important remedies are there. For example, think about Dulcamara, think about Calibrom, think about Medorinum, or think about Sanguinaria during menses. But if the patient comes and tells you, sir, whenever I get menses, the menses are not normal flow. They only hardly for a day or for half a day. And when, because of this scanty menses, I get lot of heat and lot of pimples on the face. And then, my dear friends, you have to think about, Sanguinary canadensis. Or some patient could come and tell you, Doctor Sahab, I have got pimples. You know why? Whenever I have menses date and the menses does not come on that date, I start getting pimples. Very, very important remedy you must think about is Crotalus horridus. Are you with me? Yeah, hello, are you with me? Whenever you are asking questions, and if you got result, at least say something so that I know that everybody is understanding. Menses flow only. No, we are not discussing about menses problem. We are discussing about the acnes. Let us go forward. Okay. Now there are other symptoms like acne, especially on the chin. Doctor, there's one question. Right-sided head pain, walking aggravates. No accident. See, pain in the head, right side. If I am not wrong, there are lot and lot of medicine, and aggravation by walking also you can take motion aggravation, and there are a lot of remedies. So if you could answer me, if you could tell me some of the what you call some more symptoms, I'll be happy, because otherwise there will be lots and lots of remedies and you'll be confused what to prescribe. So if you can tell me something about the other modality, the thermals, the thirst, heel pain. Okay, pain in the heel, right side. Okay, sorry, I got it. I thought it was headache. So pain in the heel, you can think, see, whenever there is pain in the heel, and the patient has first motion aggravation, means when the patient gets up in the morning and the pain starts. So these are very very common modality, and this modality, if you prescribe, I don't know whether it will be better or not, because only temporary it will be better. Although you can think about remedies like Rustox, remedies like Ruta, remedies like Calcarea Floor, think about Arenia diadana, think about Naphyllum, and think about Guaiacum, which I have used in my practice. Sahani, explain in Hindi. What is your question? या सारी सब लंग एम्पाइमा के लिए मुझे बहुत रेमेडीज तो आपको बता दिया मैंने, बट ये बड़ा क्रॉनिक प्रॉब्लम है, और इसके लिए मुझे कुछ सिम्टम्स लगेंगे रेमेडी प्रिस्क्राइब करने के लिए. सिम्टम बहुत सिर्फ डायग्नोसिस पे तो बहुत कम रेमेडीज है मेरे पास. बर्नट BT 131 टैबलेट होबी फॉर ट्यूमर एंड फाइब्रॉइड. ओके, आई हैव नेवर यूज्ड कॉम्बिनेशन, सो आई कांट आंसर. I have never used, so I cannot tell you that. So heel pain, doctor, what do you call, Dr. Madan, I hope you got some answers to your question, and let us go forward. In acne, STR, Rubens, UGN jam, calculus are the best. Okay, all remedies are best. It depends upon how you prescribe and what are you taking for prescription. That is important. So as we move forward, I was discussing something about acne. I hope this short modalities, this short explanation about the modalities of acne are sufficient. If not, then I would add something about acne more, or eruptions. There was one question regarding eruptions also. So we can go on and on. I'll just finish about one acne which is very common. You will get in your practice, and that is acne, anemic girls at puberty. These are very very important phases of life where the body reacts, and whenever the body reacts, it is basically the miasm is talking to you. When the miasm starts talking, make sure that you prescribe some medicine. So acne and anemic girls in puberty, I have got lot of cases. Remedies are Natramur, Calcarea carp, Brata carp, and Thuja. These I have used in many of my patients. Okay, so let us go forward. I think that eruptions and acne are okay. No, there is a difference between eruptions on the face and acne on the face. There is a lot of difference. For eruptions, there are some other remedies. For acne, there are some other remedies. So you have to differentiate and then ask me the question. So we have just completed acne part. Why negative thoughts make you fear and lose confidence? Which is better? Negative thoughts are a part of life. Everybody has negative thoughts, negative, positive, both. It is up to you how fast you jump back from the negativity to positivity. Whenever you start getting results, automatically you become positive, and some days you don't get results, you become negative. That's a part of life. Not every person will be every time positive in life, and not every person will be every time negative in life. Regarding the remedy arsenic or lycopodium, both are good depending on the patient's symptom and the selection of simillimum. सर लंग कोलैप्स रिकवर नहीं होता है. मेरे पास एक पेशेंट था जिसको लंग कोलैप्स हुआ था. उसको बहुत ही अच्छा रिजल्ट आया था. आई हैड गिवन दैट पेशेंट अमोनियम कार्ब. कैंट में लिखा हुआ हाइपोस्टैटिक लंग, एंड दैट patient was much better with ammonium carb. He's still better. I had one case where the lungs was totally collapsed because of fibrosis post COVID, और वो पेशेंट पूरा ठीक हो गया है. सो होम्योपैथी के अंदर कौन से स्टेज पे पेशेंट आया है और आपने सिलेक्शन कैसा किया है, वो बहुत मायने रखता है. मैंने ऐसे केसेस देखे हैं, मैंने केसेस देखे जिसके अंदर डेंगू हुआ था, ब्लीडिंग शुरू हो गया था माउथ से, ब्लीडिंग शुरू हो गया था नोज से, ब्लीडिंग शुरू हो गया था ईयर से, पेशेंट एडमिटेड था, एक होम्योपैथी मेडिसिन का डोज और पेशेंट ठीक हो गया है. सो होम्योपैथी के अंदर बहुत इंपॉर्टेंट है कि आपका सिलेक्शन क्या है उस टाइम पे, उसी प्रकार से आप दवाई सिलेक्ट कीजिए. ओके, सो लेट अस गो फॉरवर्ड. I think we have done this. I hope Dr. Madan, you got some inputs about the heel pain. Pain in the heel, because there are a lot of medicines for heel pain. And if you ask me the Matermedica, I'll go on and on. But these basically are the remedies which I have prescribed in my practice, and has given me very good results. The modalities are very, very important. Okay. Yeah, Dr. Arora, thank you. Let us go forward, and if you go forward, I will not teach something about acne, because acne is a problem where it's a very easy problem, but then you have to give symptoms to prescribe. Don't prescribe only on the color. There are a lot of other symptoms of acne. Now I'll do something. A lot of people had asked me, sir, it is summer time और बहुत पसीना आता है. We get a lot of perspiration also in summer time. So how to prescribe on that? Now, this is also a very, very important symptom. This is called as non-verbal communication. The body wants to tell you, or the body wants to heal itself, and it is showing that there is a lot of perspiration. For example, I had a case of severe headache, and the patient said that whenever I suffer from headache, I get perspiration on the head. Now, I had prescribed the patient a lot of medicine. I had prescribed the patient Merxol, and the patient was much, much better. There is one modality, one symptom of Merxol, perspiration on the affected part. Means if you have headache and the perspiration on headache. If you have stomach ache, you have pain in the stomach and there is perspiration there. A fantastic rubric, a fantastic symptom of Merxol, Rustox, Ambrosia, and also I think Entim Tarot. Very, very, very important symptom. You have to give importance to this symptom. For example, if the patient says there is perspiration and you are not able to give the remedy, and ask the patient how is the perspiration, whether it is cold, whether it is hot, whether it is staining the linen, whether the staining is which color, it is yellow color, whitish color, and then also you can prescribe the remedy. For example, Doctor, I'll just get back to you. I'll just complete my thought first. For example, there are a lot of patients who come to you and they say, sir, I have perspiration whenever I start eating. Whenever I start eating, I start getting perspiration. So we have rubrics, we have remedies, that is aggravation, perspiration, aggravation while eating, perspiration, aggravation after eating also. So whenever the patient starts eating, he gets perspiration. Think about Kalikarp, think about Merxol, think about nitric acid, think about sepia. There are a lot of other remedies also, which whatever remedy comes to my mind, I'm just telling you. And whenever the patient says there is perspiration after eating, then also you can think about sulfur, phosphorus, I think carboanibalis, carboveg, lot of remedies are that whatever it is there, this is extempo which I am understanding from my mind. So sinus with headache. Now, Dr. Arora, there are a lot of remedies for sinus with headache and a lot of other symptoms are also required for prescribing. But if you have asked only one word, then I will tell you a one-word remedy also. We have Calibicrom, we have Aurum triphyllum, we have hydrastis, we have arsenic, we have hippursulf. There are a lot of remedies. No, modalities are very, very important to understand. And when does the patient get the sinus headache? Patient unable to breathe and sleep properly due to anxiety, which medicines to work? Now see, whenever the patient has breathing problem, or if you open the rubric anxiety, and there are no and there is a rubric, there is a fantastic rubric, there is anxiety, and because of anxiety there is a breathing problem, the patient cannot breathe because of anxiety. You will be surprised to know that there are some remedies which are very, very uncommon also, which we never think for the condition of anxiety. That is, we have Ruta, we have Arnica, we have Stramonium, we have Naxomica. Normally we think about Naxomica very commonly, we think about Lycopodium, we think about arsenic also, but this Ruta, Stramonium or Entim Tarot, we don't think, but the other remedies, okay? But only prescribing only a one symptom because of anxiety, I think you will not get the results. What is the cause of anxiety? That is very important. If you understand the cause, lot many of times I have told you, cause is very important. No, a person cannot get anxiety all of a sudden. There has to be a cause, and then the effect is there. So cause and effect theory is very, very important. Okay. So menses delusion. No, I did not get your. I did not get the question. Menses delusion. I don't know what are you asking. If you can clarify. Menses suppressed due to exams and projects. Yeah. So see, whenever you get these type of symptoms, you have to go to the Bonnie-Mosen pattern. Menses suppressed because of some emotional problem. Okay, menses suppressed because of some emotional problem, and then you can get remedies, and remedies. If you will be very specific, then you might sometimes get results, you might sometimes not get results also. So if you go to our mater medica and you see menses are suppressed, and there are a lot of there are a lot of remedies, and there are a lot of conditions where the menses are suppressed, and then you start getting the remedies. So menses, or you can say amenorrhea, because of so whatever reasons, because of you're basically asking about emotions. You think about pulsatilla, think about sulfur, think about senecio, think about calcarea carb. uh, these are the remedies you must think about, or you can sepia, ferromyot, lycopodium, pulsatilla. These are the remedies. Sir, can homeopathy help in xanthosema lipid profile of? Yeah. Dr. Pandey, very, very common problem. I have also patients of this xanthoma where the cholesterol is normal. Still, the patient has. I would say I have not cured these type of cases. Of course, the xanthoma which was present above the in the of the eyelids, they are much, much better, but still they are not cured. Though the cholesterol is normal, I have these cases. Very difficult to cure. Fear of future, that what I, if something wrong will happen, and fear because of cause anxiety, patient is losing confidence. See, whenever you have fear of future, that I also had, everybody has it, fear of future. It is important that why the fear is there, how long the fear is there, and what are the symptoms because of that. A person cannot have fear of future 24/7. It's a part of life. Everybody goes through the stage of fear. Everybody goes through the stage of anxiety. Everybody goes through this stage. So you have to understand whether it is normal or abnormal. Whether it is abnormal, then why it is abnormal. Go to SORA, understand the nature of the patient in SORA, and then try to prescribe. Okay, let us go forward. Disha, I hope you understood something about menses problem. There are, if you are very specific, so I'll be very, it is very easy for me to answer. Now, you see, if I want to explain you in detail, Dr. Disha, there are some rubrics and there are some remedies which are very specific, like menses suppressed in anemia, we have other remedies. Menses suppressed with asthma, we have other remedies. Menses suppressed because of dampness, we have other remedies. Your question is menses suppressed from emotions. Then your emotions, then you can think about the remedies. You can add, lacasis is there, semesifuga is there, chamomilla is there, calcarea is there, opium is also there. So if you take exams, maybe you will not be able to understand that. But if you take emotions, then you have wide variety of remedies. That is very, very important. I had a case, of suppressed menses, and the patient said that I don't know what will happen of me. I've done so much wrong in life. Whether God will allow me to heaven. I want to do some good work, so that I have. He had a problem of salvation. So menses suppressed because of despair of salvation. I prescribed the patient Veratrum Alp 1M, and the patient got menses, and that thought salvation also was much better. So it is important to understand what type of suppression, and try to get the Bonnie-Mosen concept, the generalized concept, which is more important than the specific one. Of course, if there is very, very specific, like for instance, I had a case where the patient used to tell me that whenever I have fever, I don't get menses. So I prescribed the patient symbol Indian tobacco, that is Lobelia inflata, and I cured that case. Okay. Sir, can differentiate medicines take can cause aggravation? How now it can be? Can differentiate medicines take can cause aggravation? The concept of medicine causing aggravation is very simple. If you think that the medicine is causing aggravation, just retake the case, the acute symptoms, give the similimum, and that would antidote also, cure also. I have never used medicines, as I have always told, to antidote a particular remedy. Automatically it gets antidoted or cured if your next similimum is right. Just I would like to add one thing, Dr. Disha. Menses suppressed because of emotion, that is one part of emotion. Second is there, menses suppressed from fright. That is also very, very important, Dr. Disha. I have seen a lot of cases, fright. Exam is going on, whether the patient will pass or fail, or the score is not proper, what will the parents say? There is a lot of fright. And menses suppressed from fright. We have Lycopodium, we have Kalika, we have Nux moscata, we have Rustox. But I had a very interesting case, where 2 months had passed, there was no result. And I prescribed the patient Actia spicata, and that cured that case. So this is very, very important, this is very, very important. I hope Dr. Desai got the patient is having PCOD, got regular periods since 2 months, now again suppressed due to exams. You can take either emotions or fright. I think you have to take, Dr. Desai, in this case from fright. That is important, because in exam the fright is there whether the paper will go properly, whether I'll get good marks, or if I don't get good marks my parents will shout, or how will I come in front of public, or I will not get admission in good college. So these are the frightful conditions, and then you have to prescribe the remedy. Okay, in this case please help with some, please enable to stay calm for long due to repeated negative thoughts. Okay, so understand, do some meditation, okay, and the medicine would help you. Sir, 14 years child, hyperpneumothorax and left lung collapse. Okay, डॉक्टर साहनी गणेश जी, बहुत पैथोलॉजिकल केस है, मेरे मत हारिए, इसके अंदर कुछ सिम्टम देखिए, प्रेजेंटिंग सिम्टम क्या है, और उसको देख के प्रिस्क्राइब कीजिए, रिजल्ट्स आते हैं होम्योपैथी के अंदर. ओके, सो हम आगे बढ़ते हैं. सो डॉक्टर दिशा, आई होप यू गॉट 2 things, from emotions, from fright. Third thing, just add one thing, menses suppressed in hysterical women. Now you come to syphilitic part of it, emotions, then you come fright, and then the hysterical. So add these 3 and then you can get the remedy. Sir, can stammering be cured in 30 years old male? Stuttering is only one patient is anxious, it started from high fever. Yeah, you can definitely treat that case. Okay, you can. Yeah, I feel, see, confusion is a part of our practice, I also get confused sometimes, I cannot prescribe, so I also fail once, twice, thrice, then I get the remedy. So whatever I teach in my seminars also, I don't immediately say the first remedy worked. I also say I failed 1 time, 2 time, and 3rd time I got the remedy, and I show the remedy also. In my Germany seminar and the workshop, there were some cases which I did not get the results directly. I showed them that I failed with 1 drug, the 2nd drug, and 3rd drug cured. So failing is quite common, confusion is quite common, but still keep trying. Okay. Unable to find out remedy, Nitin, I have told you, you have to meet a doctor, because every time your question is same, every time my answer is same, because there are no specificity in this. So you have to meet a doctor and to say, otherwise anxiety, we have arsenic, we have calcarea, we have kali, we have natrum, we have lycopodium, we have a lot of remedies, So anxiety is a common emotion, it's normal. Okay. Unable to find remedy. Yes sir, I too feel so, but got confused. Yeah, that's okay. It started, stammering can be cured if it is not if it is not genetic, then it is acquired. So it is more easy to treat acquired condition. Surprisingly, I know I had got a case of DMD, muscular atrophy. My assistant had taken the case, and beautiful, the patient is responding. The first symptom, the patient came 3 days back, the patient and told, now the falling has stopped. It's a case of DMD, genetic disorder. She has 2 children, one is 7 years, not good. This guy is young, his 5 years of age is much, much better. So I'll keep you posted with that remedy. My assistant has just taken the case, and she's also very happy. So just wanted to share the case of DMD. Okay, so is that okay, or there are some other questions? I was just seeing that time. I think it is just over. So only few seconds are left. So DMD case, it's fantastic results, So it's already half an hour up, and thank you for joining, and thank you for spending time with me. I hope you enjoyed as much as I enjoy sharing my knowledge with you. Until next Saturday, goodbye.